Perform a strict identity check by asking the patient to state their full name, age, and the exact examination requested. He then explains the full nature of the examination, ensure she has removed any artifacts causing material such as rings or watches, and ask if she has any questions. Finally, he obtains clear verbal consent before proceeding. We will now demonstrate the posterior anterior wrist. We will now demonstrate the PA wrist. The PA wrist should be performed with the patient seated at the end of the radiographic table, with the image receptor placed tabletop with a 40-inch SID and no tube angulation. With the patient seated comfortably, the radiographer places their arm at a 90-degree angle, wrist flat in the middle of the IR. The radiographer asks the patient to gently curl their digits into a loose fist. This helps reduce the object to image receptor distance and brings the carpal bones closer to the receptor. The radiographer then collimates to include the distal radius and ulnar and proximal metacarpals. The radiographer centers in between the styloid processes, places the marker, and the exposure is made. This is a posterior anterior wrist X-ray image. Lastly, the lateral. The lateral positioning should be performed with the patient seated at the end of the radiographic table, with the image receptor placed tabletop with a 40-inch SID and no tube angulation. The radiographer places the wrist completely on its side from the posterior anterior position with the ulnar side down. The radiographer then collimates to include the distal radius and ulnar and proximal metacarpals, and then centers on the radial styloid process. For a true lateral, it is crucial to ensure that the distal radius and ulnar to superimpose perfectly. The radiographer checks the collimation and the exposure is made. This is a lateral wrist X-ray image.